A'udhu billahi minash shaitanir rajeem. Bismillah ar-Rahman ar-Rahim. If all of you sit here this afternoon, you all will go home with gift. If you walk away, there's no gift. So I just would like to tell you that there was a speaker, really good speaker in America, and when he came into the hall, there was just one person sitting at the back. And he then said, you know, because you are the only worker, a person sitting here to listen to me today, I'm going to give my whole talk to you. And the guy said, no, boss, hurry up, and because I'm only the security guard here, I'm locking up. So anyway, for me to talk about IMA clinics is actually very emotional, not for for other reasons, but because it's hard work, it's dedication, it's commitment, it's looking for sponsors, etc. Now, if you want to look at WHO's concept on primary health care, it says categorically on the screen, primary health care is our whole of society approach to health that aims at ensuring the highest possible level of health and well-being and their equitable distribution by focusing on people's needs and as early as possible along the continuum from promotion and disease prevention to treatment, rehabilitation, and palliative care. The South African construct or concept of it is primary health care is provided through a nurse-based, doctor-supported infrastructure via clinics and community health centers available within 5 kilometers to the residents and free at the point of service. Now, the 8 components of primary health care is public education, proper nutrition, clean water, and sanitation, maternal and child health care, immunization, local disease control, accessible treatment, drug provision. I'm just going to leave to your imagination what is existent in South Africa at the moment. For me, it's the square root of bugger all. Right. The mission statement of the IMA clinics is that the IMA South Africa is committed to providing comprehensive holistic care through the clinic programs to all the needy and disadvantaged persons to take healthcare to the people for the sheer pleasure of Allah subhanahu wa ta'ala. Right, when we go on to this fledgling to 40, I'm not going through the first lot for you. As you see, it's going up, but I would like to take cognizance of the pictures there. Some of my favorite people are at the clinics and that served at the clinics. And the bottom one is Dr. Ahmed Al-Qadi that was here in South Africa. So I'm letting that go through, and we're going to go on to the next slide. I don't want to waste more time because Dr. Catherine had spoken all about it. Okay, that's when we first started. At the moment, well, after we started, we were staffed by volunteer doctors, especially on Saturdays and Sundays, and one full-time nursing sister. Functions included immunization, antenatal care, and primary health care, and included visiting huts in the areas we served. With subsequent establishment of IMASA, the Malagasy and Marion Hill clinics were taken over from the Muslim Youth Movement and the Islamic Dawah movement, respectively. In 1986, a qualified full-time nursing staff, many full-time staff were employed. 87, we had medical doctors that serviced the clinics. Imran is here, Imran Khan, he was one of those. Adai Kum Clark, a full-time secretary and a clinics coordinator. In 1990, IMA requested to take over running of the Red Cross Clinic in Glendale, which we had to close. In the picture there you see the Assalam Clinic and the first ever nurse that worked, Karima Albertine, who worked with the IMA. She is still around, but quite ill, right? Then suddenly there came a hurricane into the Islamic Medical Association by kind favor of Dr. Khatri, who persuaded me to come and join them. So Hurricane Hanifa Ali recruited to help in 1990 part-time. And I really tried to influence the government leaders, key stakeholders, and communities with self-reliance methodologies. I changed the primordial instruments and traditional beliefs with cross-cultural consultation with elders, obtaining ethical clearances from them, which was very, very important, and participation and acceptance by our patients. All clinics relied on the generosity of the Muslim public and its membership. We did not charge initially. The estimated budget for early 1990 was 17,000 per month, which escalated to 40,000 in 1995. Initially needed to close some of the clinics, but I couldn't allow that to happen. So many appeals were made to support the clinics. And at that time, we really, really had a clinics committee that was really, really interested and involved in what was happening. Right, then we go on to the next slide, I think, and then we go, no health services for the poor in rural areas. They were the forgotten people. And here you see, you can see the wheelbarrows they came in to the clinic with. So I decided, let's go a little bit further and make a Rolls Royce of the wheelbarrows. And that's what we did. And I would like to thank the father of the Islamic Medical Association. Take a bow, Dr. G.M. Hussain. Give him a clap. He kept us going. Right, so because they were so poor, the IMA wanted to lessen this pain and help poor communities since its inception in 1979. Community leaders brought in to help IMA in this effort. They suggested we charge the people a minimal fee. They were the biggest complainants. They said, you cannot leave us. Please just charge our people something, because they take your medicines, sell them because it's free, and they sometimes think it's under great service or medicines. So initially, 300 patients were seen per month at all our clinics. Since 1990, the IMA has grown from strength to strength and widely recognized by government and many other bodies, has multifarious activities, shifting attention from injustices to understandable approaches and using Islamic principles while respecting health and ethical principles of all the people coming into our clinics. So what did we bring on then? Well, the next slide. Right, this is what we brought on: antenatal care, mother and child care, primary health care and dispensing, pick-up points for medicines, skills training, health education by Nativa. First it was by TIB, and we're grateful to Professor Beaker for that. Optometry and UKZN students come in. Our community and social events are held within the clinics and the areas. Training of students is done. Research and outreach is done together with support groups, HIV tracking and tracing, palliative care, TB, and DOTS care. So stand up and say we are not doing much for our communities. I've got a stun gun here. Okay. Let's look at the teething problems and challenges we had in these clinics. First of all, oh yes, let's just talk about the conditions. You can read them all, I'm sure they're big enough. So those are the conditions. So the teething problems and challenges: refusal by government to provide contraceptive and immunization, which forced me to go into Zweli's office just after the elections, and they also refused to let us send patients from our clinics directly to the hospitals. So guess what? I went over to Zweli and I said, boss, I was your Mpimpi. I worked with you as your runner. So you do what I want, and that is I need to send our patients to the hospitals, not to your understaffed, ill-equipped clinics. So he said, no, fine, I can do that. So I asked him for the email, which he sent to me, and we then referred our patients directly to the clinics with our letters. And that was a major achievement for us. There was no water in the area, there were no toilets, there was no electricity, and with the no toilets, the people charged each other money to use their pit latrines. No medication by government given to us, although we begged and pleaded. Then, guess what? There are people sitting here, and I'm going to mention, oh no, I won't mention, our clinics committee at that time said, what did y'all bring, Catherine? What did you bring into our clinic? This woman, she's giving condoms in the clinics. And guess what? We had to run, I had to run over to Solly and to others and say, how can they stop me from doing this in the clinics? We're having babies and babies and babies. And not only that, the STIs. Right, so these were some of the problems I had to overcome. Staffing due to low salaries, they had to leave. Lack of harmony between the people and our clinics because sisters or whoever could not speak Zulu, and everybody had to go for Zulu lessons. There was security issues and break-ins and thefts. There was poor buildings all around us falling on people, and with no electricity, they had primer stoves with paraffin. We had to start paraffin education. There were so many burns coming to our clinics. then strikes and taxi wars, non-compliance in medication because they had no food, especially TB and HIV medications, increase in quite a few diseases. So we had to start communications at strategic levels. So these were the teething problems we had, and we had to overcome them. Then representations made on behalf of the communities around our clinics. We had toilet facilities done up for them, as you can see on the screen, and water jojos and tap installations. We had post or letter collection points. So people were really happy with us and helped us keep our services going. We provided telephone service points in little huts so people could make calls for ambulances, etc. I had to speak with many of the ambulance services to come in, and waste removal was a major problem. And we then had to get people taught how to put waste in bags. We bought bags, gave them, brought them in, and called the waste removal people to take them out. Now that, for you ladies and gentlemen, is primary health care, whether you like it or not, even though I'm saying it. Okay, so here's our clinics out there. There's the Brahma Clinic, Marion Hill Clinic, Malugasi Clinic, Inchanga Clinic, Mobile Clinic, 7 service areas in Hammersdale and in Changa are looked at. And we do have very many patients. In August alone, we saw 4,380 people. If you, in our 4 clinics, right, can you imagine they had proper humanitarian care? And there's our dispensary in every service point, in all those clinics, and we have a pharmacist helping us, and the sisters are taught how to scream and shout and get things going. And they don't do it, though. They really look after the staff. And we get going. Okay, I just wanted you to look at what our budget was. The first one in 1994, the budget was 90,000. Then the budget now in 2022 is 580,000 per month. So that's a lot of money. So if you have your checkbooks or your cards, we have a machine in front, please come make some donations. And I challenge every one of you sitting here today, because you obviously care, to give us maybe 2,000 rands as a donation to running our clinics, right? And our clinic staffing, that's where the money is spent mostly, because you pay peanuts, you get monkeys. So we decided not to bring in monkeys, and we are, giving them better pay. But remember, those 4,000 some odd patients were seen only from 7:30 to 1 in all our clinics, but just the Marion Hill Clinic, which is our flagship clinic, it sees patients right up to 3 o'clock, because they wouldn't let us do anything less than that. So that, ladies and gentlemen, is where I'll leave you. And today, KZN Primary Health Care Clinics, stand as a beacon of hope for our patients and recognized by NGOs, universities, locally, provincially, nationally, and internationally, because people send their primary healthcare students to our clinics to get training. So I would like to just let you know that when I is replaced by we, even illness becomes wellness. And I want to also say to you, health is a crown that the healthy wear on their heads, but only the sick can see it. If you will lay in a hospital as I did, and that's what I found also. So in my conclusion then, I don't need the 10 minutes, sir. In my conclusion, I just would like to thank you all for being here, sitting in to see where we are, and I'm awaiting your anxious help to get us through our difficulties. Once upon a time, I was sweet and innocent. My friend Dr. Razia knows that, and her husband, Dr. Yusuf, they knew. Then I became a nurse at IMA clinics. Ladies and gentlemen, thank you.